Come on here. Well, kia ora koutou katoa. Welcome again to the Ministry of Health, and thank you for including the interpreter beside me in your picture. So, as has been signalled earlier today, we do have a third case of COVID-19 in New Zealand. I'll give more detail on that shortly. We are committed to providing timely information, and what we're going to do is do that now daily in these updates. Because we have quite a lot of testing underway at any one point in time, and we want to be able to get all the information together. In particular, as you will understand, where we have a positive test result, there is quite a process that needs to be gone through. First of all, to talk to the person and their clinician, family members, identify close contacts and initiate that process, and make sure everything is lined up before we share that information publicly. However, we will be doing it on a daily basis at these stand-ups. I'm just going to talk through some of the detail now of today's case. So the third case is a man in Auckland in his 40s who has close family, also New Zealand residents, as is this person. The family members have recently returned to this country after visiting Iran. The case did not travel to Iran. The results of the test were formally reported to the ministry at about 6 p.m. last evening. So last night, health authorities notified and had a lengthy conversation with the man and his family about the result and initiated the process of contact tracing. This is the third case of COVID-19, and I would classify this as a case of family transmission and local transmission. There's a very good explanation for how this has happened. And you may recall I've talked about the visit to China, which has shown that most transmission of COVID-19 happens actually within families because of the close living situation. So there is what appears to be a very clear link between travel to Iran recently by family members and this man who lives in the same household. Our view remains that with continued vigilance, this chance of widespread community outbreak currently does remain low. So the man who has been confirmed, this is our third case, is in self-isolation at home with appropriate clinical support from public health and district health board staff. And self-isolation at home is recognised as a very appropriate way for people to remain in isolation who have mild to moderate symptoms, as this man does. He does not require hospital level care, and neither does anyone else in the home. Now, 3 other members of the man's family had previously been unwell with mild illnesses, none seriously. They are now fully recovered and are with him in self-isolation. The man's partner has currently got a very mild illness, and so a swab has been taken to test as well for COVID-19. Public health officials last night began tracing the other close and casual contacts of the 3 family members who have been unwell to ensure appropriate protection measures are in place. That includes the flight on which 2 family members recently arrived into New Zealand from Iran via Doha. And I'm going to give the flight details shortly. So just recalling, the man who is the case has not travelled to Iran. 2 family members have come back from Iran. So we are assuming, and there's good reasons for that assumption, that one of them did become slightly unwell when he had returned from Iran. So we're assuming that he may have been infectious on the flight, although he didn't have any symptoms. We are initiating contact tracing. The flight detail is as follows. It's a Qatar Airways flight, QR 0920, so that's QR at 0920 Doha to Auckland. It departed from Doha on the 22nd of February and arrived in Auckland on the 23rd of February. So let me go on here. In addition to proactive contact tracing of close contacts on that flight by public health staff, we will also make contact with all others on the flight just to ensure they have relevant information. A reminder, close contacts are the people who were seated in the same row, 2 rows ahead and 2 behind. Healthline knows the seat numbers that these people were sitting in and will be able to advise anyone on the flight whether they are considered a close or casual contact. The close contacts will be contacted, followed up by public health unit staff and required to go into self-isolation. Of course, anyone on the flight, now that we've said what the flight number is and who is concerned or would like information, can call the Healthline number 0800 358 5453 and interpreters are available. Contact has also been made with the medical centre where the man sought advice. One staff member there who treated the man is considered a close contact and will be in self-isolation for 14 days. Public health officials are also tracing patients who may have been at the centre at the same time the man was there, as he was symptomatic when he visited the centre. They will assess whether there is any risk to those people and advise accordingly. Now, I know there's been media interest in naming medical centres involved with positive cases. At this time, we're not identifying the centres, and we do not want the public to be concerned about visiting their own general practice for routine visits. If anyone did visit one of the centres, either this centre for this case or the two medical centres for the case we talked about yesterday, the second case, they will be contacted by public health unit staff. I'm also informing you that 2 schools have also been notified about the positive test, as there is a family member of this case at each of those schools. These schools are Auckland Grammar and Ormiston Junior College. The students who attend these schools are now at home in isolation. They have no symptoms and have not had any symptoms since their grandparents arrived back from overseas. So there is no risk to students or staff at either of these schools. As I say, the students were not symptomatic at all, been at school, they are not symptomatic now, and they are being monitored at home with other family members. Now, as you well know, the Ministries of Education and Health do work together very closely with schools and will continue to do so for these 2 schools to ensure they have appropriate advice and support. And finally, I just want to repeat what I said yesterday. This family, like the other 2 families, is a Kiwi family that is affected by a virus that is part of a worldwide outbreak. What they need is support and understanding, and our task is to ensure they have all the support and great healthcare that they need. So I would like to now hand over to Katrina Casey, who's Deputy Secretary at the Ministry of Education. She's just going to talk a little bit about how health and education support schools who find themselves in this situation and, of course, their school communities. Katrina.
We have been working very closely with health, both nationally and regionally, since the original outbreak of the virus. We are ensuring that all of the critical information from health goes to schools and early learning centres in a timely manner and in a manner that is able to be digested by them. So no big jargon, and focusing very much on the messaging at the moment, which remains about prevention. More particularly with the 4 schools that are now involved, as Ashley has mentioned, we have located some of our senior staff with the Auckland Regional Medical Officer of Health and her staff, and we have been involved from the start with both cases in the planning, the notification of principals, and as we speak, we have got messaging going out from those principals to their parent communities. Today's examples are almost identical in terms of impact on the schools as yesterday's. So a lot of the messaging that we had yesterday is exactly the same. A lot of the material that we in health put together yesterday is being sent through to parents and to schools today. We will continue to ensure that principals and early learning centre leaders throughout the country receive the same information so that they are aware of exactly what we're doing. For yesterday's 2 schools, we are providing additional support as they work their way through the questions and the information that their parents and their teachers are seeking, and that will be the case today. We can mobilise in any part of the country extremely fast. And one of the things that our 10 regional directors are doing today and tomorrow is working specifically with their counterparts in medical health offices and identifying exactly who will be contacted when, what the planning will look like, and how we will mobilise if extra support is needed as and when.
So just an update on a few other matters. Whangapara oa. Now, the 6 individuals who have been in quarantine there, who had come back from the Diamond Princess cruise ship, entered their 14-day isolation today. They've had final checks. They are all fine and have been released to go back to their homes. I'm sure they are relieved about that and will be looking forward to spending time with family and friends. They all remain well. On the testing front, we've now completed over 200 tests with the 3 positive results, as you're aware, and 7 under investigation as at this morning. Currently, our test capacity is around 550 tests a day, and additional capability of up to a further 1,000 daily tests will be coming on stream over the next couple of weeks. In terms of Healthline, there are still currently just over 2,000 people currently in self-isolation registered with Healthline, and that includes families and individuals. Over 5,500 people who were registered have completed self-isolation, and again, I just want to extend my huge thanks to them for their efforts to limit the possibility of spread of this virus in New Zealand. Healthline has been busy, very busy, with over 2,200 calls yesterday, double for the same day this time last year. They are coping. They have, you might be interested to know, over 450 staff and have trained up additional staff over the last few days to cope. Their busiest point yesterday, someone had to wait for 23 minutes, and they are pulling in additional staff and can do that very quickly. Just to remind callers, Healthline is specifically for people with health concerns and or people who have been on flights that we have talked about and who are seeking information. Anyone wanting information about their own travel overseas should use the Ministry of Foreign Affairs and Trade's Safe Travel website, and or if they just want general information about COVID-19, a plug for the Ministry of Health's website, which has very good information and it is updated on a regular basis. In terms of the Ministry's Technical Advisory Group, we convened that urgently yesterday just to relook at the case definition, and that expert group is meeting again this morning to look at the case definition and our surveillance systems to look at how we might detect COVID-19 as we head into the winter. We have existing surveillance mechanisms for influenza through a network of Sentinel general practices, and we're looking at options for how we might undertake surveillance for COVID-19. Social media. We're aware, as I know you are, that there has been what I would call some hurtful commentary on social media around the family that was announced yesterday as having a positive case. I just want to reinforce the comments from Dr. William Ranger from Auckland Regional Public Health and acknowledge, as he did, there is a level of concern in the community, but I do want to call out attacks online, so-called keyboard warriors, not really keyboard warriors, but the important thing here is that this sort of behaviour is likely to harm and compromise our efforts to actually, as a country, address this challenge. We don't want people to feel they shouldn't come forward. We want people with symptoms to feel confident that coming forward is the right thing and not that they will be ostracised or criticised for that. So saying, I know the vast majority of Kiwis are not only reasonable but highly supportive, and I want to acknowledge them as well. But we don't want to be counterproductive and discourage people from coming forward. I have a final page of comments here, I hope, which, my colleague here might have picked up. Actually, it might be at the back there. And one more. There we go. Thank you. All right. The border restrictions remain in place for Category 1A countries. That's anyone who has travelled from China and Iran cannot enter New Zealand unless they are a New Zealander, and go into self-isolation for 14 days. Those travelling from the north of Italy or South Korea must also go into self-isolation for 14 days. Finally, just a final comment. For the point that New Zealand is at in this global outbreak, the World Health Organisation's recommendations and our pandemic plan are clear. This is focused on active case finding. So we want to find any COVID-19 cases out there. It is fundamental to an effective public health response and to protecting the community. The fact that we are now finding cases does not mean that our efforts to date have not been effective. They have been, and now we need to ensure our case finding, contact tracing, and isolation measures are equally effective. That requires everybody's efforts, including supporting people who are affected by the virus. I know many people are and will continue to support our collective efforts through self-isolation, through supporting people who are in self-isolation, through registering with Healthline, and also through working in our healthcare system and our frontline services. Thank you to those people, and please keep it up. I'm open for questions now.
Is there any connection between the family involved in the first confirmed case and the family in this third confirmed case?
No.
How are you going tracking people on the 3 flights that case number 2 was on?
Very well, and part of the reason for that is, as you will have seen, Air New Zealand has been fantastic in providing its call centre staff to actually contact those people. The vast majority of people, in fact, everybody for whom there were contact details has been contacted, and those who are close contacts are now in isolation, supervised by the Public Health Unit.
Do you have any update on the testing of the partner with case number 2?
That test will be being run today, and we will provide an update on that later today. I've said I'll usually do that in the media conference or update the following day, but in that case I know there's a high level of interest, so we'll aim to get that result out later today.
Have you been contacting the GP clinics that patients who visited as well as the patients that might have been going to?
Yes, we have been in touch with our Auckland Regional Public Health staff, have been in touch with both those GP clinics and are working with them to identify the level of risk there may be for either staff members or any patients who were there at the same time.
This patient clearly wasn't following Ministry of Health advice. Is the message just not getting out?
Which patient?
Patient number 2, who was told not to go to GP clinics.
So patient number 2, I just want to clarify, had rung Healthline, and also the first contact she had with the medical centre, she rang her own GP before going in. So I just want to make that clear. And yes, I do want to reiterate that message in this case. If people have symptoms, call Healthline. They'll be very good at doing an assessment about the level of risk. Or if you are going to visit your general practitioner, call ahead, or you can, if you do turn up, give a call from the car. And there are well-established protocols for how a general practice deals with someone who is coming in. For example, it might involve using a back door. The staff member who greets them will hand them a mask and be wearing a mask. Any swabs that might need to be taken would be done with the GP or the nurse wearing PPE.
Should we be rolling out dedicated clinics for this?
Not at this point, but that's something that's absolutely in our plan. We did it once before in Christchurch during the swine flu pandemic in 2009. That's the question here.
What happened with the first GP that she went to? She was obviously cleared for travel or to continue on her daily business. What was the advice that she received?
Well, the GP undertook a clinical examination, I'm sure, listened to her history and made a diagnosis and prescribed treatment appropriate with that diagnosis, recalling that this was late last week and the situation in Italy was developing very rapidly, and it was only Monday this week that we added Italy to the list of countries that people should go into self-isolation for 14 days. And that was the day that case 2, the person in case 2, the woman, sought medical help and was then swabbed.
Can we also be really clear? So the people that you've identified as grandparents have been in Iran. They've come back on the plane. One of them has potentially been unwell while on the plane, and they've then transmitted it to the man in his 40s in Auckland.
Yeah. So just to reiterate, the person who became unwell, who had been in Iran, did not have any symptoms on the plane and developed some very mild symptoms a couple of days after returning to New Zealand.
But do they have coronavirus?
Well, they're over. Yes, so there's a very clear epidemiological link from a family member who's been in Iran right at the and we know Iran is a real sort of hotspot at the moment. We can see that through the daily data. And in fact, 2 of our 3 cases in New Zealand involve travel to Iran. So they've come back, they're living in the same household. And so there's been transmission from one family member to another.
Would that not make it 4 cases? So
Well, we know we have 1 case that's confirmed, and we know that the person who travelled back from Iran is a probable case. However, what we're dealing with right now is the definite case and appropriate containment measures for the people who've had contact with the case.
So when you say probable case, what's the percentage in your mind as an expert that person will contract coronavirus?
The person.
Yeah, you just said the person can travel
So,
back.
yeah.
So how likely is it that they will get
well,
coronavirus?
they've had
Well,
it.
the implication is that they had been infected with coronavirus, developed an illness, a mild illness when they got back, and there's been transmission in the family to the person who is the 3rd case.
Sorry, I'm still a little bit unclear. So
Have
this
they
person, that person did have coronavirus, and then
What we can assume from the travel from Iran, the fact that they had a mild illness for a couple of days once back, and the fact that another family member who has not travelled to Iran now has confirmed coronavirus.
so
Okay.
you're presuming that this person has recovered.
Indeed, they have, yes.
So you've tested, just to clarify, you've tested for that, so they,
No, there's no indication to test. The only other family member that has been tested is the case's partner, because she still has some mild symptoms, and we test people who have symptoms. However, we are presuming that the person who travelled back from Iran and became symptomatic is a probable
So
case.
you won't or you can't retroactively test the virus.
There's no indication to.
what does that mean?
Because
What does indication mean?
Because they don't have symptoms.
Yeah,
or-
yes, because they don't have symptoms, and
They've
we can.
definitely had symptoms.
They have had symptoms, yes.
So could you test now if you chose to, or is it because it doesn't meet a diagnostic criteria?
You could offer testing if the person, but there's no reason why the person necessarily has to be tested, and we can infer through their travel history and the epidemiological linkage with the current case that person is a probable case.
Isn't
Can
that
I-
more person-to-person transmission, given that this
Yeah.
this family had the virus for approximately 11 days?
Yes, well, I anticipate that we will get person-to-person transmission in New Zealand. What we're doing now is following up all the close contacts of the family members, and in particular in the workplace of the case, and also friends who visited, and those people are all in self-isolation now. Again, this is consistent with what the WHO mission to China showed, that in China, most of the transmission was happening in family situations, so inside the home.
Sorry, I just want to clarify this because I think it's important to be clear. Is this accurate? It is presumed that the person who travelled back from Iran who infected their family member will contract coronavirus.
No, that's not
No.
correct. What is correct is that person developed a mild illness after they had got back to New Zealand, and we are presuming that illness was COVID-19. They are now asymptomatic. However, a close family member now has had an illness that has tested positive as COVID-19.
Did that person pass it on to the family member, or did the 3rd case get it in Iran as well?
The 3rd case did not travel to Iran. So we have a situation here where a family member travelled back from Iran, and presumably and probably, so a probable case, there's no indication to test because they are now symptom-free, passed it on to a family member. This is consistent with what's been shown in China. You had another question?
When you say this is a family transmission, how far away is it from a community transmission?
So community transmission is where you would get cases outside of the setting where, so for example, outside of the home, outside of the workplace, where in particular you may not know where the person actually contracted the disease from. And it's very clear here, this is a case of person-to-person transmission inside New
So
Zealand.
this case is a family transmission, but if we look at what dates they came in, this is coming in like 23rd of February.
Correct.
And the person on the plane that was ill, that probably had COVID-19, hadn't been in isolation.
So
had travelled.
the person on the plane became ill, wasn't ill on the plane,
Okay, so
became ill when they
became
got
ill
back to
in
New Zealand. Yes.
What has that person done since arriving in New
Yes,
Zealand?
I don't have all the details, but rest assured that Auckland Regional Public Health Service has a very detailed description of what each family member has done in the intervening period, where they have been, and is doing an assessment of whether there is a possibility of close contacts or of casual contacts, and is taking appropriate action.
What do you think in terms of tracing the second case and their movements through Palmerston North? How far have you progressed with that? Because we've got reporters down there who say that it appears that the second case may have spent time at Tuananga in Palmerston North, and there was possibly an event attended by 200 people.
Okay, well, that would be speculation. I don't have that information, but I have asked for it, and we will provide publicly the information about places where that person may have been, and we're seeking that information. Now, the Public Health Unit has that information.
So how are you doing that? So you get this information and say from these particular cases, you trace their movement. How do you deem whether that's important enough to announce to the public like you have with the schools, for example?
Yes, so two things there. All the contact tracing is done by the Public Health Units, as with any communicable disease, and they have really well-established protocols. So even that first phone call to the case, they have a very detailed form to find out about any possible family or other close contacts, where they have been on a day-to-day basis, whether they might have been out shopping or at work or whatever. And then they make an assessment, depending on the period of time and the proximity to other people, of course, where they've sought medical attention as well. In terms of the schools, again, to reiterate here, we have 2 students, neither of whom were symptomatic, and who are contacts. You cannot get the infection if you are a contact of a contact. However, what we also know is that schools are of great interest to people, and we have made the call in discussion with families and with our education colleagues. It's better to name the schools, because in our view, it would be out within about 5 minutes anyway after our media conference.
Sorry, I was just going to ask you, sorry, keep going.
So that's all, please.
I was just going to ask you about modelling that we talked to you about on Monday as well. How many people do you expect to get coronavirus, and why aren't you releasing this modelling?
Well, it very much depends on the assumptions you use, as does any model, and we're looking to Australia that has done some modelling as well. So the modelling continues, as does some scenario planning, but of course you change your assumptions as you get more information as we go along. But so saying, there have been modelling done of influenza pandemics for New Zealand in the past, and in worst case scenarios you can see large numbers of infections, large numbers of hospitalisations, and high numbers of deaths.
So what modelling are you using, and shouldn't you be making that public so that we know what to prepare for? You guys can see what's going to happen, the public can't.
Yes, what we can do is model scenarios to inform our planning. What we can't do is predict the future. And so, look, we'll have no trouble releasing modelling and what the findings are, but it's work in progress at the moment.
What's the time frame on that?
I'll come back to you on that. Yep.
There's a group of 15 Italian tourists in New Zealand at the moment from northern Italy, and they came in just before the requirement for self-isolation. Do you know where they are or what they're doing? Now,
my understanding is that there was an original group of Italian tourists that has now gone back, so have left the country last night. There is some speculation about a group of Italian cyclists who are here in Rotorua, and the local public health unit is talking with the organisers of the cycle trip they're on and working with them to just see if we can get the right actions to be taken there.
And the ones who have gone back now, do you know what they did before they went back?
No, that's all the information I have.
Yesterday you said that the chances of community outbreak were low. Do you still believe that?
Yes, and I started off with that in one of my comments. In the current situation, the chance of widespread community outbreak remains low. And yes, we have individual sporadic cases, as we call them. We want to find these cases. It's a good thing that we are finding cases, because then we know we can put the right measures in place. If we don't find them, then they could go on and infect others.
People in voluntary isolation, how are they being monitored? You said Healthline are being kept busy. Are they having to monitor all of these people that are in voluntary self-isolation?
So the people in voluntary self-isolation who are registered with Healthline get a call every couple of days. Some don't need or want that. They're just registered. The people who are the close contacts of the cases, they are daily monitored by the local public health unit.
Can we just case number 1, you were able...
Excuse me, sorry, we've got other commitments.
Yep. Just two or three more questions.
Case number 1, you were able to provide the numbers of people that you were tracing. What is the situation with them 2 and 3 in terms of actual cases of close contact and provided tracing around that?
I thought I had the numbers with me. I don't have them here, but as you can imagine, there are lots of numbers to think about. What I can say for both case 2 and 3 is the number of close contacts, either family, friends, or work colleagues, is relatively modest. In both cases, they've all been contacted on the night that the case was a confirmed positive and have gone into self-isolation.
And then obviously there's firm numbers from planes.
Yes, in terms of the
So there was a
confirmed.
Palmerston North
Yes,
and
yep.
the Doha.
Yep, of the close contacts, yes. So the Doha flight, which is related to this case that we're talking about today, that contact tracing as well is underway. And as I say, we've said the numbers of the flights. Healthline knows the seat numbers that the people who travelled back from Iran were in, and anyone who rings them, they'll be able to let them know whether they are a close contact, and then they'll be referred to the public health unit or a casual contact and just provided with information.
Are you able to get that information, that the individual focus for both case 2 and 3 in terms of
We'll
planes and stuff? I know you've got a lot
Yep,
on.
yep. We'll see what we can pull. We'll just have to get that from some different sources.
Can
Yep.
we just clarify, just to be clear about this? So the third person who is now confirmed,
Yes.
and there was a family member who you think is now recovered.
Yes.
That that family member who's now recovered should also be labelled a case.
Yes. So we're saying that's a probable case.
But why not a definite case?
It's not confirmed. You only call someone a confirmed case if you have a positive laboratory confirmed sample, and you will have seen other countries do this as well. Yep. So as we get, and we don't test because the person is not symptomatic.
So on a scale of 1 to 10, how confident are you that that person did have coronavirus but that has now recovered?
Very confident not on a scale of 9 to 10. I'm very confident. There's a very clear epidemiological link here. The person was symptomatic, mild symptoms. A reminder, most people who get illness will have mild to moderate symptoms.
Can we just why not test for it though? Like, they may not have symptoms, but why not test?
At this stage, we are only testing people who are symptomatic, and there are good reasons for that, one of which is you might come up with a negative test. All that means is you've got a negative test. In this case, there's a very strong epidemiological link with a country that we know had widespread infection happening, and that is the cause of a number of cases in other countries right around the world.
Is it a case of you can't compel this person to take a test, or you're not able to?
I couldn't. I wouldn't be wanting to compel anyone to take a test, but there's no look. In any person in this situation, or when they go and seek medical attention, you investigate them if it's in that person's best interests. That's the person who we focus on. So we're very confident there's an epidemiological link. I think we've been open about the fact we think this is family member transmission, and we are doing all the right things to make sure that the family is in isolation and others are protected. That's what we're all about here.
When you gave us those list of numbers at the beginning, you gave us 200 tests, 3 positive and 7 investigating. Should we add another category there to say 1 probable?
We'll be looking at that, and we'll get advice from our technical advisory group. As you can imagine, this is all emerged within about a 12 to 15 hour period. We haven't been in this situation before, so we'll look at that.
So for our terminology, just because we love terminology, we'd go 3 confirmed cases with a 4th probable case.
Yes, correct.
Highly likely.
Yes.
Cool.
Yep.
Last question.
And we've known about this third case. You said 6 p.m. last night.
Yes.
Why is it taken until now to release these details
Yeah.
to the public?
Yeah, just let me explain that there is a really involved process that means we have staff here till quite late and talking with the regional public health staff. So they run the laboratory test in each lab at about 10 o'clock each day. It takes several hours. Then they have to do checks to get the confirmed, if it's a positive result especially. Then the key thing there is, of course, there is a range of people that need to be contacted: the clinician, the person themselves, then all the detail has to be got. We then come into the picture and assist with, if there has been flights, then we have to do a thorough process to notify our immigration colleagues and customs colleagues to pull the flight cards. So we want to make sure we've got all the information. Then we do get a bit of sleep. We come back in the morning and there's a whole lot more activity. But what we do want to do is make sure we are balancing the protection of the privacy of the individual and their family with the key public health response. And again, we will keep being open and we will give an update. It may well be in days or weeks to that we have more than one positive test on any one day. The numbers are likely to increase, but at the moment we are getting sporadic, unlinked cases, and we are in the business of contact tracing and isolation. Thank you very much for your ongoing support, and we'll see you again tomorrow. Thanks.
No worries, thank you.